Hello, Jantans and Jantanites. It's Jason Desmond from the Jantan Collective with a very interesting discussion this time around on What's Up With That. This is where we question, we learn, and we grow, especially this time around. Remember to subscribe, like, and comment below. We love hearing from you. It might be something that we talked about before and you want to talk about it even more. You want to tell us about it. Or it's something we haven't talked about yet, and you think, hey, maybe these guys need to talk about it. Get in touch with us. We love hearing from you. Now, today, we're getting into something that people have been talking about it for months, ever since the pandemic started, vaccines. Now, thing is, though, there have been talk, there's been doubts about it. People are wondering, are the vaccines safe? And from my point of view, I don't get it. Why are people still so hesitant about it? Will we ever achieve herd immunity? Seriously, what's up with that? Now, to really to allay all our fears, to give us the hard facts, the hard scientific facts, we have with us today Dr. Kavita Reginald. She's a senior lecturer at Sunway University and also an EXCO member at the Malaysian Society of Allergy and Immunology, MSAI. Thank you for joining us. I know you just had a class. Fridays are crazy. But thank you so much for taking the time to have a chat with us. Before we get into all this, I know you're with the Malaysian Society of Allergy and Immunology as well. How did you get into this field? How do you specialize in something like that? Or did you just start off as just being interested in medicine? How does that work?
Right. So I actually did my PhD many years ago in the field of allergies. And currently, I continue to do research in the area of allergies. I have postgraduate students. I have a lab in Sunway University. So it was just a natural inclination to want to be part of an NGO like the Malaysian Society of Allergy and Immunology, to advocate, topics related to allergies and related to immunology.
But what got you interested in it in the first place, though? Did you have allergies as a child, and then you're like, I wonder what's going on with me?
So I don't have allergies, and I never had allergies as a child. Neither does any of my family members. What got me interested is a very somehow interesting story. I had an opportunity to do an internship in an allergy laboratory in Singapore when I was an undergraduate student, and that world just fascinated me. I then found out that about 30%, at that point, it was 20% of the worldwide population actually had some form of allergies.
Right.
And I was wondering, how can we get rid of these allergies? How can we overcome it? And that sparked my interest into the research of allergy, even at such a young age.
Can you get rid of allergies though? Really? I mean, like certain things like asthma and whatever, it's been around for so long.
So that's right. It has been around for so long. And maybe you cannot get rid of it 100% for now, but there are a lot of ways that we know how you can manage these allergies.
Right.
So some of the ways are, as simple as getting rid of the triggering factors from the environment, getting the right medication. In fact, a couple of days ago, Star newspapers came up with an article saying that 30% of asthmatics have been misdiagnosed. So getting the correct diagnosis is also very important.
Really? What do you mean by misdiagnosed? That means all this time I've been taking Ventolin for absolutely nothing.
So it's not really, maybe I'll correct myself. It's mistreated. So they've been given the wrong form of medication. So for sometimes very long, long-lasting doses of medication, and they actually didn't need them.
Right.
I'm interested in looking at a different type of therapy. It's called immunotherapy. And this has been shown to actually modulate the immune system.
How's work been though? I mean, recently of late, have you still just been as busy? Has the work changed? Because you mentioned that you had class.
Sometime last year when the first MCO hit, I'm sure you remember that those beautiful days.
Yeah, the bad old days,
was stuck at home. We had to adapt very quickly to a fully online mode of teaching. Now that the MCOs have been modified in the way that people can go out a little bit more and do important activities, education falls under important activities.
Yeah.
So some of the activities like teaching practical labs have now gone back face to face, but we still maintain part of our classes, the lectures, etc. online.
Nice.
We have learned a lot. my colleagues and myself have learned a lot over the last 1 year on how to do an online class in an engaging manner, because it's not easy to speak to a screen or a little camera and expect your audience, the students or whoever's listening to you, to be actually engaged with your material. So we have learned different tricks of the trade, asking questions, using interactive material to actually engage the participation of these students.
It takes a lot. So I really respect what you guys are doing, teaching in this environment. But you know what? It's a very strange environment that we're in right now. We've been at it for a year and a half, maybe slightly less. And now only we've recently been able to really talk about the vaccines. In the early days, the vaccines were like, ooh, it might happen, it might not. Will it get approved and whatnot? But now there are so many vaccines out there. It's hard to keep track. How many actual vaccines are out there for COVID-19?
So you're right, it is difficult to keep track. So in fact, right now, there are about more than 200 vaccine candidates that have been, that are going through research and at different phases of development.
Really? Wow.
Yes.
But the ones that have been approved we know about the Pfizer.
So the ones that have
right?
been approved in Malaysia are 3 vaccines. So these are the Pfizer vaccine, AstraZeneca, and Sinovac.
Oh, that means Moderna and Johnson & Johnson?
They're not in our shores right now.
Okay.
So they approved for emergency use, which means the national body, so in Malaysia is the National Pharmaceutical Regulatory Agency, or NPRA,
Right.
is the one that is in charge of giving approvals for vaccines to be used within the country. So each country will need to do their own due diligence and approvals.
So it doesn't necessarily mean if WHO or the Americans say, hey, this is safe, we're using it, doesn't mean that Malaysia and other countries here will automatically use it, right? We have to approve it ourselves.
That's right. So the NPRA takes on the responsibility to check the effectiveness and approve the vaccine before it's being used in Malaysia itself.
Actually, you know what? On that, I'm always very doubtful, and I don't know whether it's the right, whether I should be doubtful whenever they say it's 100% effective. Is there such a thing as 100% effective?
So far, Pfizer and Moderna vaccines, which are the RNA-based vaccines, have reported an efficacy rate of around 95%.
Yeah,
which is
90.
Very,
I'm okay with 95,
high.
Right? 100 though, some of them are saying, is there? I don't know whether anyone is 100% effective, right?
That's right. So the efficacy changes, and it always depends on the group that is doing the clinical studies and what is their endpoint that they are looking at.
Right.
Are they looking at how many people did not get severe disease, or how many people did not show symptoms at all? And that's why the efficacies of these different vaccines differ.
Oh, it's what they want to find, whether it's for seniors,
it is what they have,
children.
It is what they have decided for their clinical study,
how
they decided to measure it. So a classic example is when we compare Johnson & Johnson and Pfizer. So Pfizer, as we all know, had shown a great 95% efficacy.
Yeah.
Whereas in Johnson & Johnson, the rates were much lower at maybe about 66, 67%. So there were 3 main differences in these 2 clinical trials. The first was for the Pfizer vaccine, Pfizer and Moderna, the trials were conducted in US, mainly in US, and conducted in the period where the number of cases were not that high.
Right.
So you can see that the results were almost the same.
Okay.
Johnson & Johnson had a stark difference. So the stark difference is it was held in 3 trial centers in 3 different countries. So in the US, South Africa, and in Brazil. The case rates were much higher compared to in Pfizer and Moderna.
Okay.
And because they were conducted in 3 different trial centers, these areas also had different virus variants.
Right. Okay. So the original, then the EEC strain and whatnot, I suppose. All right.
Correct. So they had the South African variant, the Brazilian variant, etc. And therefore, when they collated all this information that they got together, it seemed that the efficacy was lower, but there is not a one-to-one comparison because we don't know how Pfizer or Moderna vaccines would have fared in those conditions.
So when you look at the vaccines themselves, some are mRNA. What's that? Memory RNA, if I'm not mistaken, and then the other one is like live. What are the differences amongst all the vaccines that are out there?
Okay, so there's this mRNA vaccine, which is the messenger RNA.
Messenger, that's right. Yeah.
Yeah, and then we have for example, the AstraZeneca vaccine, which is a viral vector vaccine. So they use a weakened whole virus that is genetically engineered to produce the SARS-CoV-2 proteins.
Okay.
Then if you look at Sinovac vaccines, right? These are heat inactivated virus. So they take the whole SARS-CoV-2 virus, and they treat it with either heat or harsh chemicals that it is unable to infect the body.
Okay.
It cannot cause an infection, but it is sufficient to trigger the immune system to respond to it.
Right. So all of it, it's actually just to bring out a response in our system.
That's right.
Come out with a shield of sorts.
Yes. So this shield is called antibodies.
Okay.
Okay. These antibodies, when they are produced against the SARS-CoV-2 virus, they then latch on, they bind to the SARS-CoV-2 virus, and it helps the body to get rid of it.
Okay.
So to clear the infection.
In some of it, that means there are some SARS-CoV-2 elements, but the Pfizer one, which is the mRNA one, doesn't have any at all, right?
It has a genetic code for a part of the protein of the SARS-CoV-2 virus.
Yeah. So I think that's the one that gets people very confused. So basically, it's just, as what you said just now, it's just triggering us without causing any harm.
That's right. So none of the vaccines can actually cause you to have COVID infections. It's only the full COVID virus that is not inactivated, that is called a live virus, that is capable of giving you the infection.
But they all have the same element, is it? The different strains, they all have the same basic elements, I suppose you want to call it that?
It's depending on the companies and how they decide to produce it. But most of them contain some element of the spike protein. So the spike protein is the one responsible on the whole of the COVID virus to attach itself to the cell. And that's the entry point of the virus into the cell.
Right. So that's
the virus needs to enter the cell to infect the cell.
Okay. So that's the main culprit, I suppose you want to call it that. So the side effects, though. Yes. The side effects people keep talking about this, and I've heard this before, and I've heard it from friends, and I've read about it. Some people have no side effects when they take the first dose. They just say like, oh no, just a pain in the arm, and I have a slight headache, whatever it is. Are some of these side effects that people are feeling expected?
Yeah. So there are actually two things when we talk about side effects. So the side effects that you mentioned are kind of the immediate discomforts that you feel when you take in a vaccine. So you will have, a sore arm, for example, slight fever, tiredness, aches and pains in the body that, lasts for just a couple of days. And the reason why this happens is the immune system is triggered, and there's something called cytokines that are being released. Yeah. So This is nothing to be worried about. This is normal, absolutely normal, and almost every vaccine that triggers the immune system, so I'm not talking about COVID vaccines now, but any other vaccines that you have taken, can also induce a similar response. But what people are more concerned about currently are the adverse effects. So this is slightly different than what you have mentioned, like about the fevers.
The blood clotting?
Correct. So the concerns are about the adverse effects. And I need to stress one very important point. These adverse effects are extremely rare, no matter which one you're talking about. So, so far we know that the Pfizer vaccine has been reported to cause anaphylaxis in a very rare condition, right? So it's 10 per million doses.
Right. Oh, okay. Right.
While the AstraZeneca vaccine, so the latest news is all about the AstraZeneca vaccine and blood clots.
Yeah.
But the rate is again extremely low. It's 4 in a million.
But they are keeping an eye on that. If I'm not mistaken, all the ministries of health all over the world that has AstraZeneca in their systems, they are keeping an eye on that
That's
in
right.
case it does happen, right?
That's right. I mean, there is a risk, but the risk is extremely low.
Right.
And really, in terms of the AstraZeneca vaccine, the risk of getting blood clots by a COVID-19 infection is so much higher. The rate is 165,000 cases per million, compared to 4 per million. So the risk benefit of the vaccine is very clear.
I think what people need to understand also is that sometimes when we get sick and we get a fever, it's our body fighting some virus or whatever that's attacking our body. The fever is actually a good thing, right?
Yes. The fever is a sign that there is a reaction occurring within the system.
So how do we prepare to go to take a vaccine?
I think there is no special preparation. Just go with a very positive mindset. If you're really worried, go with a friend. But really, the medical professionals are there. They are observing you. Like in the case of the Pfizer vaccine, I've spoken about anaphylaxis. And the majority of cases, even if you have such a reaction, occurs within the first 15 minutes of injection.
Right.
But when you're vaccinated, you're observed for 30 minutes. So any risk of any adverse effects will be taken care of by the medical professionals who are around.
Yeah.
So there's really nothing to be overly worried about. If you are very concerned, speak to your medical professional before you get the vaccine. Some people have comorbidities, they have other illnesses, and they may be concerned, would it have a negative effect on me?
Right.
Have a chat with your medical professional. Ease your worries.
How do you change their minds about this? Why are some people still so hesitant about getting a vaccine?
So you're right. I mean, one of the biggest concern of why people are hesitant is because the COVID vaccine was produced in quite a rushed, as you said, rushed manner. And somehow the media had a hand in, this to portray the efforts to develop the COVID-19 vaccine, like a race.
Yeah.
Who is the fastest to come up with the vaccine?
Right.
And just this kind of portrayal has actually fueled a central but false tenet of the anti-vaccine lobby.
Yeah.
That lobby that, these vaccines have not been adequately tested for safety. Okay, so let's take some time to talk about this, because this is extremely important to put people's, fears at bay.
Yeah.
So we know that the average vaccine takes about 10 years from the beginning to a preclinical phase. But we also know that with the COVID vaccine, it took about a year or slightly less than a year. Okay, so why is this? So there are several key factors that we need to understand, which is different with the COVID vaccine. The first was the research on COVID vaccines did not begin in 2020. It began much, much earlier, because there are actually a huge family of coronaviruses. And so the research has actually started on these different types of coronaviruses. In fact, Oxford University had already started to work on an adenovirus-based vaccine against MERS, the Middle Eastern Respiratory Syndrome virus, which is a coronavirus family member. Second, there was a huge effort of a worldwide collaboration in coming up with a vaccine. So as soon as the virus genome was available, the Chinese researchers had released the information to the worldwide researchers. So they had this information to start developing the vaccine already. Next, the research was also fast-tracked because there was such a global urgency for getting this vaccine out, and the amount of red tape by FDA and CDC were greatly reduced. There was, a push for the COVID vaccines to be produced and prioritized.
Right.
Of course, vaccine production, research, etc., requires funding. And there was massive funding by multiple funding agencies. So these funding agencies were both of the state, so national level funders, as well as private individuals. So one example is the Bill and Melinda Gates Foundation also funded certain vaccine projects.
Right.
Then we had the technology. So for the first time, we are seeing the mRNA technology come to light. But the mRNA technology has been there. It's just, it has not been put into such an urgency for use. So we had the mRNA technology and the adenovirus technology that could allow for very fast turnaround time to build prototype vaccines compared to traditional methods out there. Finally, clinical trials. Suddenly, we had a large number of patients who are infected with COVID virus, and therefore you had people to enroll into clinical trials. And these clinical trials had used the existing networks to conduct the trials. Rigorous guidelines were imposed. FDA was having heavy scrutiny on all these trials, and there was a lot of safety monitoring post-vaccination that occurred. And that all those 5 main points resulted in a faster vaccine production because of a global effort, a global cooperation, and sufficient funding for this process to occur smoothly.
So I'm absorbing all this. That means basically, if I understand correctly, Dr. Kavita, that means the code for the coronavirus had already been researched many years ago before this pandemic started, because there was SARS, there was MERS and whatnot already. So they used the code to build on this vaccine that we have right now. But it's not really fast tracked. It's been in the works for years already, but because of the urgency that we need, they've just the CDC probably fast tracked a lot of things. Isn't this a good thing? This should be a good thing. That means in the future, we have the technology and the know-how and the knowledge on the database and everything to fight other pandemics and other coronaviruses, and there will be more, isn't it? It's a good thing, right?
So that's right. So maybe I'll just make a slight correction to what you said. So the code of the COVID-19 vaccine was only available in January 2020.
Right.
But what was known previously are the similarities with all the other coronaviruses.
Right.
So one classic example is they knew that the spike protein was where the coronavirus, the protein the coronavirus used to enter into the human cell. And they even knew the target human cell that it used to enter into. So you're right that it's a good thing. And it shows you what a global cooperation can do, what breaking down, this rigid red tape that we have for different processes. Indeed, they are there for a very good reason, but sometimes when it comes to a global emergency like COVID-19, it is important to work together and reevaluate how we are working for human health and the importance in preserving our life and health together.
Because when this first came out, people are like, oh, but it's so quick. And I'm like, that's a good thing that they can produce vaccines so quickly now, and it's safe to use, and that can only help us in the future. But now the big thing is, especially here in Malaysia recently, was the sign up for the AstraZeneca vaccine. And I think I was offered it or something, and then anybody could have signed up as long as you're in the Klang Valley. The moment I found out about it, it was already like it was already done. They had to close the registration. I think it took like how many hours? I don't know whether it was like a half hour, 90 minutes or something like that.
Yeah, so this AstraZeneca vaccine, when it was offered as an opt-in by the ministry, was taken up just last weekend in 3.5 hours. So there was 268,000 doses taken up very, very quickly. You're right about that.
I would have been, I was eager for, I heard about all the blood clotting issues and whatnot. And I still was like, you know what, at this point, any vaccine is a good vaccine for me, right? So I'm actually looking forward to them rolling out a second round of this. But because there's always been this talk about the older folk with comorbidities, seniors and whatnot, and pregnant mothers and everything, and younger people have not been included in vaccinations for some reason. Or am I wrong? What's the correlation with that? What's going on with that?
So what we have observed is that the younger adults, although they are infected, they are mostly showing to be either asymptomatic, so without any symptoms, or their symptoms are very mild. And therefore, they have not been prioritized in vaccination. However, the older folk with a poorer immune system and also comorbidities seem to have more severe symptoms. They end up hospitalized, requiring oxygen, and a lot of the deaths are due to are found in individuals with these comorbid conditions.
Long
And
story
therefore,
short, that means they
this,
would have passed on anyway, but it was done. COVID just kind of pushed them over the edge sooner. Is that what that means?
it's probably that because they have already so many conditions. So with a failing respiratory system, it makes things much worse.
Right. Okay. So
And therefore, the older generation has been prioritized for the vaccination.
Right. So it's more crucial for the older folks to take the vaccine. So should young people be registering for the AstraZeneca if it actually comes around again for us to sign up? Should they sign up, and how young can they sign up for?
So I would definitely advocate that anybody above 18 should definitely sign up for the vaccine if you have an opportunity. Because by vaccinating yourself, you're not only just protecting yourself, you're protecting your loved ones around you, especially those who are, more compromised, more vulnerable. And why wouldn't you want to protect your loved ones?
Yeah. I keep hearing and reading about this. It's not a cure, but it's to help you deal with the more lethal or stronger effects of the virus. But once you get the vaccine, you stop being a carrier or something like that.
So the vaccine, you're right about one point. The vaccine actually helps you to prepare your immune system to respond very quickly to the virus. Okay? But what it does not do is it does not prevent you from getting infection. You can still get infected. You may be asymptomatic. You may show mild symptoms. What all vaccines have shown to do is prevent you from having severe symptoms against COVID-19, prevent hospitalization, and prevent deaths due to COVID-19.
Yeah. And that's a big thing because hospitals
That's a big thing.
They're already at critical. They cannot handle. I think it was the health DG that said they're already at 90% capacity already right now. But are you infective after you take the vaccine?
You can be. So if you are a carrier, you definitely can infect another person who has a weaker immune system than you. Definitely. Right. Whether the next person actually shows severe COVID symptoms or is also asymptomatic is not known.
Right. So that's
why in Selangor, they're actually carrying out an exercise for the citizens of Selangor to have a voluntary test, swab test, to find out if they are silent carriers of this virus.
Right. We're guinea pigs in a way. That means even if you get the vaccine, continue wearing those masks because you don't know, you might infect someone else, right? But there's still a lot of concerns about all these vaccines, whatever vaccines were coming in. These vaccines, is it halal? Especially in Malaysia, I suppose it's a big thing, right? Is it halal?
So I'm not an expert in religious matters, but as far as I understand, it is permissible for all Muslims to take the vaccine.
Okay,
that's all I can comment for that.
Close enough. I'm quite happy with that. And I guess if you want to find out the real, like the full one, you can actually check with probably Jawi or Jais or whatever it is. But another one, oh my God.
And it's very clear that the Prime Minister was the first person to take the vaccine. The DG was the second person. And we also had our Minister Khairi Jamaluddin taking the vaccines, all three Muslims.
Yeah.
And there should be no problem, actually.
Exactly. I mean, you follow what they do, right? I was watching, I don't even know why I watch Fox News really in the US, but so I was watching Fox News and they always come out on Facebook, all these small videos, and all these other anti-vax podcasters. I just want to see what they're saying, right? And they keep harping on the fact that mRNA will modify your DNA, and then you'll find that in 10, 20 years time, you're going to find that you have even more problems than now, and it's going to affect your immune system, it's going to affect you neurologically and whatnot. Can vaccines like this modify our DNA?
Okay, so it's quite a common misconception, whatever you've mentioned about mRNA getting integrated into our DNA and making us into mutant
Yeah.
beings. I've also heard parts of those conversations. In fact, it's very simple. If you have done any level of biology or research, you will know that mRNA is extremely fragile. It's an extremely fragile molecule which can disintegrate very fast. And this is the reason why these mRNA vaccines need to be transported even and at extremely cold temperatures.
Right. Okay.
Yeah. So we have right now like Pfizer vaccine, which is an mRNA of a part of the COVID virus, not the whole COVID virus, just a part. And it is protected by a fat layer, a lipid layer. Because without this lipid layer, the mRNA will degrade much, much faster.
Right.
Yeah, so there is no way that this mRNA will ever get integrated into the cell, into the DNA, our DNA, and actually change it. These are all false information.
Yeah, some people
Although
are watching
it sounds
sci-fi.
very fancy,
yeah,
but it definitely cannot occur.
Yeah.
Yeah.
Thank you for clearing that up. I love the fact that we can clear this up, because people need to stop watching Fox News and getting the information from there and then just listen to the medical experts. So we also know that after you get a vaccine, it's still best to wear a mask, because you can still be a carrier, you can still be infective. But the thing is also now, there's been talk of, like, if you start off, let's just say with Pfizer for the first dose, there's been thought that you can even get probably Moderna or AstraZeneca or whatever it is, a different vaccine for the second dose. Can you combine vaccines? What does it do?
So we'll go back to the clinical trials. The clinical trials have only been done and only been conducted with the same vaccine as the second dose. Yeah, so it is a very controversial topic to talk about mixing vaccines, because nobody really knows what is the efficacy, what are the effects of mixing different vaccines. The only time when this thing is ever considered is if somebody had an adverse effect, not side effect, but adverse effect to the first dosage, then it could be a point of discussion with your own doctor to get some advice, or, on what could be done for the follow-up vaccination. Do you actually take a second shot? Do you take something else? It is still being debated even among the medical professionals for this part. Okay. So for now, the current recommendation is, if you started with one, for example, you started with Pfizer, take your second dose with Pfizer in the allotted time frame.
Well, we don't know what we're getting, or we have no choice in that. So they tell us,
who signed up for AstraZeneca, I think you're quite sure you're getting AstraZeneca
for the second dose, for the second dose as well. So that's how it works, right?
Yes.
Okay. Correct. Okay. Right. Just wanted to be clear. Now, another thing that we would love to have cleared up, because there's always this, it's like a buzzword now, and everybody knows about it. Back then it was flatten the curve, and then we said, okay, let's have a lockdown, we can flatten the curve. Nobody really knew exactly what that meant, but a new one now that everybody's throwing around is herd immunity. Everybody talks about, we need to, from both sides of the fence. Some people say, if everybody had COVID and everybody got over it on their own, we would have herd immunity. Another one is saying, let's all get vaccinated and we'll get herd immunity. What is herd immunity, and will there ever be herd immunity?
Okay, so herd immunity is, simply put, the ability to resist the pathogen, or the virus in this case. Okay, and you can resist it, as you said, in two different ways. One is you build your immunity because you have a natural infection to the COVID virus, or you can build your immunity by having vaccination. So what is the difference between both of them? So if you have natural infection, it can go in one of three ways. You can either be asymptomatic, you don't show any symptoms at all.
Mm-hmm.
You can be having mild symptoms, or you could have severe symptoms that lead you to get hospitalized and perhaps even die of COVID-19 infection. So the last one is definitely not desirable, right?
Yeah.
The safer way of building immune response is by having vaccination. So by having vaccination, what you skip is all the symptomatic part. So you don't have the symptoms of COVID infection, but you build your immune system, you build all these antibodies against the virus. So in case you come across the virus, the live virus again, your body can react and protect yourself against the virus. How many people do we need to have vaccinated to reach herd immunity? The numbers are variable depending on who you talk to, but generally, it is estimated about 70 to 80% of a population need to be immunized. We know that children are currently not recommended to receive vaccination. So if we remove children and remove those people who are not eligible for vaccines due to certain illnesses, we will need to still have 80% of the eligible population to be vaccinated.
Right. I wonder where we are at the moment.
So at the moment in Malaysia, we are about 2.83%, slightly under 3% of vaccinated individuals. Our neighboring country, Singapore, has about 23%. India has about 10%. And you can see very clearly how much they're suffering with the new wave of COVID. Places like US have reached about 40% at the moment. Israel has over 60% vaccination.
Holy, serious?
So there's a very diverse range of population, percent of population at least receiving their first dose.
Oh, wow.
That's the current state worldwide.
Okay, so I don't know, because I think the target was supposed to be by the end of this year. They wanted to get like herd immunity or something like that. The targeted number, we seem to be quite far off. But another thing is we hear so much, almost constantly, that it's mutating. There are new variants. It's starting to like I think Singapore recently found a new strain. The vaccine that we have been developed now, is it for the original strain? Is it for other variants? Is it even effective against all these new variants?
So I'm happy you brought out about the part about variants. So variants happen when there are mutations on the virus, and the virus mutations on the virus may or may not affect the spike protein where the virus binds to the cell and enters the cell. Yeah, so this is where the vaccine targets are being developed against. However, having said that, leaving a population not vaccinated for a long time and allowing these mutants or variants to circulate in the population can result in the vaccine not being able to neutralize these mutants as effectively as the original variant,
right,
for which the vaccine was developed. So the recommendation is definitely to get the vaccine rollout as smoothly as possible to as many people as possible, so that they build the immunity before having to deal with all these different variants.
Right.
Of course, there's also a question on how long can these current vaccines last, and
we need to get booster shots and stuff like this. Yeah,
we need booster shots, etc. You have to take it into context. So the first ever vaccine that was given to anyone outside clinical trials was in the UK, and this was back in December 2020. So even if you take that as a starting point, right to now, we only have 6 months of information.
Right.
In Malaysia, the first vaccination happened on 24th of February. So we only have a hindsight of about 2.5 months.
Yeah, 3 months. Yeah, 2 months.
So the clear answer right now is we don't really know how long it's going to last. Although some experts have estimated perhaps a year. So regarding the mutants, there have been some talk among the scientific community that perhaps there will be a need for a booster shot annually, just like the flu virus.
Yeah, like a flu shot. Flu shot, people take it every year.
That's right, just like a flu shot, which people take every year without a fuss.
Yeah.
So we just may need to envision that we'll have to deal with COVID in a similar manner.
Yeah. I don't see why that it's a problem. So hopefully everybody sees the light of day in that one. But a big issue now is the numbers are so scary. The infection numbers are so scary. And everything's relative. I mean, when you look at the numbers in India, their fatality numbers are our infection numbers, basically, almost, right? But it's still scary. Our numbers have spiked. We have clusters everywhere. We're into lockdowns here, then everywhere. But I hear that the numbers, and again, I have to be very clear. I hear, this is hearsay, that the numbers are not 100% accurate. That means it could actually be higher.
So the numbers really depend on the amount of testing, right? The more you test, the more you find. The less you test, the less you find.
Yeah.
So that definitely can be one factor of it.
So why is suddenly Selangor and KL? That means suddenly someone just was a bit lax, and recently they're like, hey, you know what? Let's do some more testing. And then they found a bunch, or what happened here?
So let's just roll back to sometime last year when we talked about the first MCO.
Yeah.
Actually, what the Malaysian government did in the initial stages is very commendable. They had a very quick initial response when SARS-CoV-2 virus went out of control.
Yeah.
So sometime mid-March last year, we had the first MCO introduced, and I'm sure a lot of people will remember. For about 2 months, we were all locked into our homes.
I don't think anyone can forget that.
It was a relatively strict lockdown. We started to work from home, study from home, and also many businesses had to close. And this was shown to be very beneficial in what you said earlier, to flatten the curve, so reducing the virus infectivity. But we also remember that many people lost their sources of income during this period, right? And so for the subsequent movement control orders, we had, MCO, CMCO, RMCO, and all these different variants of it.
Yeah.
They were rolled out in a more targeted manner. But having said that, we are all aware that current MCO that we are all going through doesn't seem, or seems to have lost kind of its effectiveness.
Yes.
Okay. So why is it? So as I keep thinking about it, and as far as I see it, I find that there are several reasons to this. One is the SOPs. So the SOPs have not been clearly spelled out, and sometimes, there's a U-turn. You say something one day, and the next day,
correct,
the SOP
there's
has
no
changed.
consistency. Yeah.
Yeah, so the consistency is problematic, and the information is conflicting. And the second reason could be that there is some kind of a pandemic fatigue. People are just tired of following rigid rules, and they start to flaunt them. And even when they do flaunt them, they find that because the enforcement is not really, up to mark, that even for those who flaunt the SOPs, either there is no action taken, or there is uneven type of action taken. Some people get very heavily fined, while others manage to, slip through the net. And all these different reasons make it that although MCO is there, it's merely, maybe not merely, but more often than not taken as a namesake.
Yes, it's just a name.
But what we need to do as a community is actually not wait for the government to impose something upon us. If we all take our own responsibilities and just follow the simple SOPs, what the DG has been mentioning day in and day out: physical distancing, regular hand washing, face mask wearing, will actually be in a much better space than now.
But Dr. Kavita, like Malaysians, you can't even trust them to flush toilets in the public restrooms. Can we leave it to the community to do this themselves? Sometimes I think in Malaysia especially, it's a whole case of you spare the rod, you spoil the child. We need things to be a bit more strict here.
Again, to take things into context, we have been doing so much better than a lot of the European countries when it comes to following the rules. So let's not forget that we have shown the possibility to do it during the first MCO, and I'm certain we can do it again. Just we need to have this community spirit again, and the collective reason to actually get out of this pandemic. Just believe it, and you can just work together with your friends. Everybody just nudges their friend, and I'm sure we'll be able to do it together.
So, but generally, you think everything the government has done so far would, if you had to give them a report card on how they've been doing so far handling COVID, would it be a B plus?
From my own perspective as a scientist and also Malaysian citizen, I would say that if several things can be improved, definitely. The messaging when it comes to rolling out the MCOs, the enforcement in people who flaunt the rules. If those things are done in a correct manner, then definitely, like in the first MCO, we found that the numbers actually went down. We had this community spirit of bringing the numbers down, and we really applauded it. I still remember very clearly there was one day with 0 new infections.
Yeah.
And everybody was so joyful and clapping hands. What happened to that times? We are having 3,000, 4,000 cases even every day.
Yeah.
We should really stop and think of our actions. Is it really necessary to go out? Is it really necessary to meet up in crowded spaces? If we can just reduce the risk, every one of us take an individual, as well as collective responsibility, there is definitely a way out of this. So there are countries that have done this successfully. Look at New Zealand.
Yes, I was just about to talk about New Zealand because they've been very strict with it. Singapore is very strict with it as well, to the point where if we were able to handle it as well, we would actually have a reciprocal green lane open again, or like a travel bubble. Countries around us, near us, have done it. Where are we compared? Because you say Europe has been a bit lax. Yes. Which country has gotten it right the most so far, you think?
I think New Zealand has done a pretty decent job in, and even maybe Australia, to a certain extent, in having this short lockdowns when there's even a few cases in the community, which is community transmitted. Closing the borders played a big role in allowing the numbers to stay down. I think we all remember the Sabah elections to, be one of the trigger factors that actually increase the number of cases. So if we can just reduce and minimize all risk to increase the numbers, I think we'll be at a better place.
But also,
it's just that
industry, and then they're saying, "Oh, we're losing jobs and everything." That nudge sometimes about economy. Does that cause the numbers to not be the curve to not flatten as quickly as we want it to?
There always needs to be a balance. Of course, that you need to have businesses to be open. People need to have life as well as their livelihood. If you don't have sufficient to feed your family, no one's going to follow any rules. Let's be honest here. So there needs to be a balance. So while we conduct our daily activities and businesses, my only call is to let's evaluate the risk that we are taking part in, and let's just try to protect as much as possible.
We do our part, right? I love what's the old hashtag? Kita jaga kita. We can still do that, but the rules we know work. They worked before MCO, the first MCO, it worked. Yes. MCO 2, it was a balance between economy, even MCO 3, economy, and also trying to flatten the curve. So that we know works. It might take longer, but that'll work. Vaccine rollout, what are your thoughts on that? Are we getting it right? Are we not? What needs to improve?
So from the very beginning, there have been some criticism about the speed. so that Malaysian government has been slightly slow in procuring the vaccines. But this was only because they wanted to be super sure that these vaccines that they're procuring were effective, and they're waiting for some kind of efficacy data. So I really don't know whether it's right to blame them on that. But having said that, they have been extremely proactive in procuring vaccines from different sources. And this has been important to minimize any form of risk in terms of vaccine distribution, access, or even we didn't know at that point what were the potential side effects of any of these vaccines. So we had backups and backups of backups, which is, really a good thing. And by December 2020, so end of last year, the access to vaccines had been assured by the government for 82.8% of the population in Malaysia. So this had already been secured. Of course, we know that right now we have finished or almost completed phase 1 of the vaccination, where the frontliners are vaccinated.
Yeah.
And we are currently at phase 2 of the standard vaccination national immunization program, which is targeted to the older generation. And we've already spoken about AstraZeneca that was opened up as an opt-in for individuals who are living in Selangor and Kuala Lumpur last weekend, and that was swiped up within 3.5 hours.
Yeah.
All 260,000 doses of it. There has been slight delay in the speed of the vaccine rollout because of supply issues, and this had not been taken into consideration because we did not know that this is going to happen. Other governments, other suppliers have been supplying to, you can say, quote unquote, richer economies who have blocked the vaccine distribution to us. But we expect that these issues can be overcome in the coming months because we have other suppliers that will be supplying us with vaccines. So hopefully, this slight glitch and slowdown in the vaccine delivery to the country can be overcome relatively quickly. And then what we need to work on is correct messaging, positive messaging, and getting people registered for the vaccines.
Yeah. So thing is, the messaging is the very important element of it all. I can't remember where I saw it. Was it in the US, or they did a study about who says what to the general public to convince them to take the vaccines. And then they did a study, and they found like celebrities telling you should take the vaccine, politicians, I think this was in the US, that doesn't work. It just didn't get people signing up for vaccines. It just didn't make people more confident on the vaccines. So what's the best place for someone to go to find out more about the vaccines that's legit?
Okay, so if you want to find out about information about vaccines in Malaysia, what's happening in Malaysia, I think the best place to go to is vaccinecovid.gov.my.
Okay.
If you're interested about the global outlook and what's happening worldwide, the WHO website is actually pretty good. So it's covid19.who.int. So those are, really legitimate websites where you can get good and updated information.
Because it is the World Health Organization, right? So
definitely,
that's the place to go to. So when it comes to COVID, when it comes to the vaccines, when it comes to lockdowns, when it comes to SOPs, what advice would you give to the general Malaysian who's feeling pandemic fatigue, who's just sick of it, who's a lot of it, people are actually going through some mental health issues already because of this strain. What advice would you give them to just hang in there?
So we know that COVID-19 pandemic is real, and it's a real threat to our lives as well as our livelihoods, right? So please get vaccinated. It will not only protect you against severe symptoms of COVID, hospitalization and death, but it'll also protect your loved ones. Practice the SOPs, And these include the simple ones, safe distancing from others, regular hand washing, as well as wearing a face mask. I'm confident, and I say this really from my heart, that if we do this together, we can definitely overcome this pandemic.
So from a medical professional standpoint, what should I be telling my friends, my acquaintances, people who follow me on social media, who are still slightly on the fence about taking the vaccine?
So I think it's very important to find out why they're on the fence.
Okay.
Yeah, a lot of times when we are communicating to people, we're communicating to them and not actually addressing their concerns.
Right.
The first step, in my opinion, is to find out what is it that is, making them hesitant or not confident in the vaccine. Only by understanding this, you can guide them to the right source of information. So, you can avoid all this misinformation. That's one. Sometimes the concern is a genuine medical concern. They may have certain comorbidities. They do not know how their body will react, for example, or, is this particular vaccine or the other vaccine better for them?
Yeah, like my dad, who's a dialysis patient, I don't know whether he should be taking the vaccine or not. So I'm concerned about that as well. You're right. You're absolutely right.
So in that case, definitely go and speak to the doctor, whether they speak to the doctor alone or, with the support, as you said, this mental health issue. So support of a loved one or a family member is very, very helpful to get all the, different types of information. Clear your head, clear your heart, and what is actually the right information out there before you go and get the vaccination. Right. But I think the important part is, having a dialogue, actually talking about it. What is it that concerns you? And then trying to get the right information to allay the fears, to get the right understanding about vaccines, side effects, adverse effects. Those kind of things will definitely help somebody to, as you said, get over the fence and actually take proactive action to get vaccinated.
Yeah, I think for the longest time, I think we've been guilt tripping them to try to get them to take the vaccine. It's your responsibility. It's for the other person, but we forget about the other person. I'm worried about me, right? So I think you're absolutely right. We need to have an open conversation about this. But are you, Dr. Kavita, confident about our future? Because some people are like, we don't know when we're gonna get into a normal life again. This new norm is taking too long. This new norm is not what we signed up for. Will we ever go back to normal? And what will normal be like? How confident are you that things are gonna be good again?
So we talked about herd immunity earlier. We really focused on Malaysia at that point. But actually, this herd immunity has to be a global effort. It has, like the vaccine was a global effort. Now the herd immunity also has to be a global effort to combat this pandemic. It is not the first time humanity has, seen a pandemic before. We had, the flu pandemic much earlier on, about 100 years ago. But we are here. We are the few generations after those individuals who have overcome the pandemic. They didn't have technology at that time. They did not have correct messaging at that time. So hopefully with all the new advances that we have, and we actually have a vaccine now, and I'm sure they did not have a vaccine within 1 year or during the previous pandemic. We should really take advantage of all the positive things that we have and use it to our benefits. I think if you want to doubt, you need to have real reason of doubting something, not just doubting for the sake of doubting. I think that those things don't help us at all.
Yes, just for the sake of it, just because someone said something, right? And I think the real pandemic, the real problem right now, yes, COVID is there. It is a big problem, but the real pandemic is fake news. I'm having a huge issue trying to convince people, like, where are you getting this information from? No, that's wrong. I don't think you should be listening to this. Fox News, what are you doing watching American news in the first place? And regardless of how much I love Joe Rogan and listen to his podcast and everything, sometimes Joe Rogan says the wrong things, and I'm very concerned about that. But on that though, because the Jantan Collective is all about helping men be better versions of themselves, right?
I
So
see. Okay.
what can men do to help the community? Do we need to be stronger role models? Do we need to I don't know. What advice do you have for us?
All I can say is COVID does not discriminate. So whether you're a man or you're a woman or you have not assigned a gender to yourself, it really doesn't matter. The rules are simple. If you are eligible, please get vaccinated. Even after being vaccinated, just please follow the SOPs. It is really not too much to ask for to wear a face mask and practice simple hygiene measures. This is really the minimal, right? Other people have died from this virus and even other diseases. So why are we feeling so privileged that we can't even do simple things to protect our health and protect our loved ones? I think we should change our mindset and see how we can actually be the change. As cliche as it may sound, be the change, be the one who does the positive, be a positive role model for everyone else.
That's the perfect way to end this. But this chat has cleared my mind about vaccines, about how we're doing things, because I've been not overwhelmed, not underwhelmed. I've just been whelmed. I suppose, I'm just in that zone of being whelmed in general by the situation, by vaccines, by people not wanting to play ball. So thank you for this chat with us. Thank you for allaying our fears. Thank you for clearing up a lot of things that people have been doubting. And we hope that we will achieve herd immunity soon, and we'll see what happens in a few months. If things change, we'll be having a chat again, Dr. Kavita.
All right. So I also want to thank you very much for inviting me. And in fact, I want to invite everyone to an initiative from the Malaysian Society of Allergy and Immunology.
Yes.
We are going to have a Malaysian Allergy Day on June 19th. And this will be live via our Facebook page. Our Facebook page is allergy.msai, allergy.msai. And you'll find out more about links between allergies and COVID-19, or even other current topics about allergy management and the therapies that are available. So do join us. It's a free event. There will be a couple of allergists, so a specialist in allergy, joining us and giving the latest in the field to everyone. And definitely you'll have an opportunity to ask questions to them as well. So I really hope to invite the community that's watching this particular show to also join us in the Malaysian Allergy Day.
Dr. Kavita,
on the 19th of June.
19th June, Jantan Collective, we will be there. We will be part of it. And thank you so much.
That's excellent. Thank you very much. And hashtag stay safe. Lindung diri, lindung semua.
Kita jaga kita.
Kita jaga kita. That's right.
Hey, I hope you enjoyed that discussion we had with Dr. Kavita about vaccines. We hope you learned something new. In fact, did we miss anything that you'd like to know? And maybe we could get in touch with Dr. Kavita for another conversation. You know what? Let us know in the comments below. And ultimately, though, this was a very eye-opening discussion for me, and I hope it was for you as well. Thank you so much for watching. Remember, don't be a dick. Go get vaccinated.